Hi guys, it's your next nurse Florence and you're welcome back to my channel where we talk all about emergency health and wellness tips. In today's video, we're going to be talking about how to perform breast self-examination. We're going to be talking about when you should begin breast self-examination and when you should perform it. Stick with me. Breast self-examination is a screening technique which allows an individual to examine his or her breast tissue for any visual or physical change in size, texture, and consistency. It helps to screen for pathologies such as tumors, cysts, inflammation, ulcers, lumps, and other abnormalities in the breast. It also helps one familiarize oneself with the shape, size, and texture of one's breast, grossly assisting in the determination, early detection, and improved prognosis in the treatment of other breast abnormalities should they occur. There are many conditions that can cause breast changes, and they include but not limited to breast cancer. Thus, the breast self-examination technique is not always a reliable way to detect breast cancer in terms of specificity of the condition. However, a significant number of women who have been diagnosed with breast cancer report that the first sign of their breast cancer was a new breast lump they accidentally or consciously discovered on their own. For this reason, medical practitioners recommend being familiar with the normal consistency of one's breast. Breast self-examination should begin as early as age 20 and maintained throughout a lifetime, with the technique to carry it out taught and reviewed periodically. It is important for every woman to know how their breast looks like, the feel of their breasts, and should be able to know when something is wrong. Breast self-examination should be performed after the menstrual period on the 7th day of the menstrual cycle, when the breasts are smallest and least congested. The pregnant woman or the menopausal woman who is not having menstrual period is taught to select a specific day to examine the breast each month. In the advent of the palpation of a lump during breast self-examination, one should not panic and conclude that breast cancer is the most definitive diagnosis, for there are numerous differentials ranging from non-cancerous diseases to benign cancers that could be responsible. However, the lump should not be ignored due to the possibility of a malignancy and should be taken to the medical professionals for further investigative review or for further investigation. Step 1. Begin by looking at your breasts in the mirror with your shoulders straight and your arms on your hips. You should look for 1. Breasts that are their usual shape, size, and color. 2. Breasts that are evenly shaped without visible distortion or swelling. If you see or notice any of the following changes I'm about to list, bring them to your healthcare provider or your physician's attention. 1. Dimpling, puckering, or bulging of the skin. 2. A nipple that has changed position or an inverted nipple. 3. Redness, soreness, darkening or swelling of the breast skin. Step 2. Now raise your arms and look for the same changes. Step 3. While you are at the mirror, look for any sign of fluid coming out from one or both of the breasts. This could be a watery, milky, yellow fluid or blood. Step 4. Feel your breasts while lying down, using your right hand to feel your left breast and then your left hand to feel your right breast. Use a firm, smooth touch with the first few finger parts of your hand, keeping the fingers flat and together. Use a circular motion about the size of a quarter. Cover the entire breasts from top to bottom, side to side, from your collarbone to the top of your abdomen, and from your armpit to your cleavage. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of the breast. You can also move your fingers up and down vertically in rows as if you were moving along. This up and down approach seems to work best for most women. Be sure to feel all the tissue from the front to the back of your breast. For the skin and tissue beneath, use light pressure. Use medium pressure for tissues in the middle of your breast and firm pressure for the deep tissues in the back. When you have reached the deep tissue, you should be able to feel down to your rib cage. Step 5. Feel your breasts while standing or sitting. Many women find that the easiest way to feel their breasts is when their skin is wet and slippery. So they like to do this step in the shower. Cover your entire breasts using the same hand movements described in step 4. So guys, we've come to the end of this video. If you find it helpful and useful, give me a thumbs up by clicking on the like button. It is free. Let me know what you think about breast self-examination in the comment section below. Don't forget to subscribe to my channel. Click on that bell icon so you'll be the first to know when I upload new videos. I'm your next door nurse and I'm just a knock away. I love you guys.